Hi, good morning. Are you Miss K? Hi, I'm Dr. Aina. I'm the doctor in charge of Madam Z. May I know your relationship with the patient? Okay, so first of all, I would like to say I'm so sorry about what happened to your mother, but I will try to explain it to you so that you will get the whole picture and understand what's happening, alright? Okay, as you know, your mother has a chronic kidney disease as well as ovarian cancer. So she actually admitted for fluid overload, whereby basically there's a lot of fluids inside her body. So we initially try to give her medication to help her remove all these excess fluids, but unfortunately she does not respond to the medication. That's why we opt for a dialysis to help her to prevent any further deterioration. Unfortunately, during the dialysis process, she developed fitting due to low calcium level. We try to give her some calcium and eventually she recovers. So, but why does this happen? Okay, I will try to explain it to you. Alright. So as we know, inside our body we have kidneys, and the function of kidney is basically to remove all the excess fluid as well as waste. So when a patient have chronic kidney disease, their body or their kidney cannot do this function. They cannot remove fluid, they cannot remove waste product. So what we can do is we actually hook up the patient to a machine called a dialysis machine, which basically function like an external kidney, okay, to help the patient to remove waste and fluids. Okay, but all procedures that we do have some complication, and the complication that kind of occurs actually happen to your mothers. Okay, so far do you understand? Do you have any question? Okay, so first of all, in patients with chronic kidney disease, they tend to have low calcium level because the kidney cannot activate vitamin D, which is very important for calcium absorption. So when they cannot activate vitamin D, cannot absorb calcium, the calcium level in their body will be very low. Okay, and when we do dialysis to this kind of patient, some of the calcium inside the body might be removed as well by the dialysis machine, which can further aggravate the low calcium level. Okay, and number two, like I mentioned before, the dialysis machine helps to remove excess fluids, but sometimes when it tries to remove the fluids, the rate of the fluid removal is too fast, so the patient body unable to cope with the sudden drop in the fluid level, thus causing the patient to become hypotensive. So when these two factors occurs together, like the hypocalcemia or low calcium with the low blood pressure, it can affect the brain, which eventually can manifest as fitting, which happens to your mother. So as I mentioned, dialysis also have its own risks and complication. So that's why all patients who done dialysis or is undergoing dialysis, we will keep an eye on them. So since we keep an eye on all patients with dialysis, we managed to catch your mother during the fitting promptly, and we give her calcium level, which eventually helps to her to recover and become better. So what I want to say is that the fitting that occurs in your mother is because of the low calcium level as well as hypotension. But currently, she's currently very stable and she's well after we give the medication, which is the calcium, and we will further keep an eye on her to make sure that she's stable throughout the admission. Alright? So as of now, do you have any question that you want to ask, or do you have any further clarification that you need from me? Yes, we will do our best to take care of your mother, and you don't have to worry, alright? Okay. Again, I would like to say I'm so sorry that this happened to your mother, but you don't have to worry. She is in a good care right now. Thank you.